Hi guys, my name is Ijeoma. I'm graduating this year, the class of 2017. I wanted to share with you my approach to CS before I leave. I know the written part will be attached to your Blackboard, but I kind of wanted to talk it out with you guys in case you're struggling with how to approach each case. I found that with this approach, of course I used first aid and prepped each case, but this was just helpful to organize my thoughts with chief complaints that I didn't prepare, like fatigue or, I don't know, my elbow hurts. It helped me kind of organize my thoughts. So I'll just talk it out, and again, the actual paper that I used, the printout, will be available to you on Blackboard. So for each case, you have about, maybe they'll tell you doctors you can begin, and so you knock on the door and then go in. But before you knock on the door, I kind of waited outside and gathered my thoughts. And so for each case, I drew this quadrant on a sheet of paper that they'll give you on the clipboard. Make sure not to draw on this until they say you can begin. So again, I would divide the paper into a quadrant, and these were each of the labels. This top right was HPI, or the history of the presenting illness. Over here, review of systems. Over here was a mnemonic that I kind of used that was very helpful for the rest of the history. And that we will call Pam Hugs Foss. Okay? And then over here, I will put the differential diagnosis. Now, in my opinion, this quadrant is the most important. So again, I said, before you walk into the room, you kind of want to draw this quadrant. You don't have, if you memorize what goes in here, you don't have to label each thing. But also before I went in, I would spend about a minute thinking about the differential diagnosis based on the chief complaint they gave me. So if they said this patient's coming in with a cough, I would think, okay, what is the most likely diagnosis? Because it's not something extraneous, it's very common. So I would think, okay, upper respiratory infection, I don't know, maybe pneumonia, I don't know, maybe foreign body. I would just think of I would list about 4 or 5 things here before I even walked in, so that could also help me guide my questions. And you will find, because it's pretty straightforward, if you ask certain questions, like did you have a runny nose, did you have a fever, they would say no. You can kind of cross out pneumonia because it's less likely, okay? But at least you kind of have 3 diagnoses that you can write on your template when you leave the room. Okay, so HPI, pretty much what you're familiar with by now, old cards. So that's your onset, your location, duration, character of the symptom, alleviating factors, or aggressive factors, relieving factors, the timing, and the severity out of a 10-point scale. By now, you should feel comfortable eliciting this type of history. If you get stuck and you don't know what else to ask here, then move on to your review of systems. And I kind of used a head-to-toe approach. You can use whatever works for you. But my head-to-toe approach started with general. So any fevers, chills, lightheadedness, dizziness. And then I kind of added this here, trauma. Trauma is simply that, trauma. Have you had any recent falls, any head injuries? Have you lost consciousness recently? And then I just went down the body. So HENT, I would do cardiac next, chest pain, palpitations, respiratory symptoms, cough, things like that. Then I did GI symptoms, abdominal pain, nausea, vomiting, diarrhea, problems with urination, extremities. That's when I would do the numbness, tingling, weakness, any stroke-like symptoms there. And then here, I would include psych. Now, psych was kind of, I didn't do this with each case. Like if they were coming in for cough, it's not really appropriate. I mean, not necessarily appropriate. You don't have to ask, are you feeling sad today? But for other chief complaints like fatigue, things that are very vague, fatigue, headache, loss of appetite, sleeping more, I would make sure to include psych as a reminder, and then I would use sicky caps. And by now, you should know what sticky caps are based off of your psych rotations. Also, you can simply, if you don't want to go through this, you can simply ask, are you feeling sad? Have you been feeling sad lately? And if you remember, that's a question that can help you determine if this is a depression or if this is some sort of psychiatric problem that's causing these symptoms. So after I did that, I moved on to Pam Hugs Foss. So Pam Hugs Foss, your past medical history, any allergies, this is important to ask, any medications, and of course you want to include like vitamins here. H was hospitalizations. I also included surgeries here, previous surgery history, because if you have surgery, you have to stay in the hospital. So over here is kind of what I put in parentheses. Let's say I was rushing and I forgot to ask about urinary symptoms and sleep. I would throw it in here as a reminder. So urinary, GI, and then sleep. I would kind of throw that in there if it was necessary. If the case didn't really seem like it was appropriate, then I would move on, of course. Over here is your family history. OB history, this is important for CS, because if she's a female, you want to make sure to ask if she's had any children. You never know what could be associated with it. So if she's had any children, if she's had any previous abortions, miscarriages, anything like that. Over here is sexual history. Again, for step 2 CS, this is very important. So for instance, I had a case that was very non-specific, and everything I asked this patient was no. Until I got to sexual history. Like, okay, are you sexually active with men, women, or both? How many partners have you had in the past? Do you use protection? And that's where all the information came from. Like, oh, maybe this is a sexually transmitted infection that's causing this non-specific symptom. So it's important to ask this question, at least for step 2 CS. And then over here, the last S is social history. And if you haven't noticed, I'm a mnemonics kind of girl. So I have another mnemonic for social history. That mnemonic is sad, Wade, toss. And straightforward here, this is smoking, alcohol, drug use. Again, if you can't read this will actually be on Blackboard, so you can look exactly at what I'm writing. But this is smoking history, alcohol, and drug use. And again, this is important for step 2 CS, because not only do you want to ask if they're smoking any cigarettes, you want to ask if they've ever smoked any cigarettes, and then follow up how much cigarettes have you been smoking, for how long. And then most importantly, what can give you a few more points on CS is to ask if they're interested in quitting. If they're not interested in quitting, just suggest, you know what, we're here for you whenever you want to. If you want to schedule an appointment, we have some things that can help you quit if you are ready for that. That's it. If they do surprise you and say, oh yes, I want to quit. You're like, oh, I wasn't ready for that. But all you can just say in that sentence is, you know what, I'm so glad to hear that. Let's schedule another appointment where we can come back and discuss how you want to quit smoking. And that will kind of elevate your communication points and the certain points that they use to evaluate you. Similar thing with alcohol. You want to ask if they've ever drank alcohol, do they currently drink, how much, go through the rigmarole. And then again, you want to ask cage questions. So it's outlined in the first aid, step 2 CS, so make sure you read the front part where it discusses follow-up questions for alcohol, because it can be very helpful. And similar with drug use, have you ever used illicit drugs? Do you currently use illicit drugs? Last time you used, blah, blah. Over here is weight rather. So for me, that meant any weight changes, any appetite changes, diet, and exercise. Over here, diet and exercise I kind of reserved for cardiopulmonary presentations, so like chest pain. That's when I would ask about diet and exercise. Otherwise, you don't really need to do that if you're pressed for time. But weight changes could be helpful, and appetite changes could be helpful as well. And over here, the toss, let's say you forgot to ask about trauma. You can ask about trauma over here. Occupation, so what do you do for a living? Are you still employed? Are you retired? Any recent stressors in your life that can be helpful. Let's say if someone has a headache. Let's say if someone's feeling sad lately. And over here, I put spouse. And that was just a reminder for me to ask, who do you live with? And so every time I present this, people are like, oh my gosh, that seems like so much. Did you have enough time to get through this material? But because you're so organized and you walk in with the game plan, you're just going through these questions. I guarantee, well, I can't say guarantee, but for me at least, it took 10 minutes for me to get through all of this. So I had ample time, or 5 minutes rather, for me to get through all of this. So I had ample time to do the physical exam, and then I always left with 3 or 4 minutes left in my HPI time to spend writing my note. So because you're so organized and you have a systematic approach, no matter what this chief complaint is, you should be able to at least get more information from your patient, enough information from your patient to elicit a good history. And then based off of this information, you can cross out things in your diagnosis that were wrong, and then you can also add things that, oh, this might be this and that. So that was my approach for the history. A few more things. So after I left the room, it was time for the patient note. And again, you want to have an approach because you have a limited time. The key thing about the note is to go bottom to top. I don't know if you're like me, but I'm pretty verbose, if you haven't noticed. And so I can spend all of the 10 minutes they give you for the note just on writing the history. But it's important, the more important part of this note is actually your differential diagnosis and what you're going to use to order to defend your differential. So start from the bottom. Go to the bottom of the note, write down your 3 top diagnoses and what you would use what labs you would order. And then go to the physical exam. Make sure you include the vital signs. They will give you the vital signs, so make sure you include that, and then go through what you found with the physical exam. And then go backwards and fill this part out. So key things, I didn't write down the physical exam. I can tend to remember what's important in physical exam, but if you find that you can't, be sure to write down what was significant there. Make sure you wear gloves or wash hands. I didn't want my hands to be dry all day, and also didn't want to waste time washing, drying. So actually, if you use gloves, that's enough. You don't have to wash your hands if you just wear gloves before you approach the patient. Make sure you also kind of announce what you're doing. It's very weird, like, hi, is it okay, first of all ask, is it okay for me to do a physical exam? Okay, well now I'm going to look into your eyes. Okay, can you open your mouth? Now I'm listening to your heart. Now I'm feeling your belly, see if there's any pain. Kind of announce what you're doing so the patient, the standardized patient, can check off things that you did on the physical exam. And a few more things. Last but not least, there is a template available online for you to practice the patient note. I would highly recommend that because of the character limitations. You want to kind of have an approach for how you're going to type it. Are you going to do bullet points, sentences, keep everything on one line, separated by a semicolon? Just practice that, get that under your belt, so the day of the exam, you kind of know what you're doing, you're feeling confident, and you know you've passed by the end of the 12 cases. Okay? Well, best of luck. I wish you the best. I can't guarantee this is going to give you a pass, but at least this can help you organize your thoughts.